Hey, ladies. Thank you for being here. I am so excited to dive into today's podcast. But first, I want to grab your full attention really quick because I want to talk about something really exciting that's coming up. If you have been feeling exhausted, overwhelmed, anxious, or you feel like you're just living in constant survival mode, then listen up because this is for you. I am hosting a brand new 3-day mind body healing workshop. It's unlike anything I've ever done before. This is for you if you're a woman who feels like you've tried everything. You've tried all the supplements, the diets, the therapy, the positive thinking, and you still feel stuck in your stress, stuck in your symptoms, and in a spiral of burnout and survival mode. Over the course of these 3 powerful days, I'm going to teach you the exact nervous system regulation techniques that helped me and hundreds of women like you finally get out of fight or flight, start healing from chronic stress and trauma, and reconnect with our true selves, reclaiming our energy, getting our confidence back, and finally living in alignment with God's calling. You'll learn how to calm your body in real time, release trapped emotions and patterns that are keeping you stuck, release those limiting beliefs that are ruminating in your head, reclaim your energy and your mental clarity, regulate your emotions instead of reacting, rebuild your confidence and self-trust, and start feeling safe in your body again. This isn't just about managing your symptoms, it's about transformation. It's about becoming the woman who no longer feels like she's barely holding it all together. It's about healing at the root of your symptoms so you can finally feel that peace, your power, and your purpose in your everyday life. It's practical, powerful, and it's exactly what your nervous system has been craving. So grab your spot now. The link is in the show notes. There's limited spots available. I cannot wait to walk through this with you. See you there. Hey everyone. So we already know how many people feel stuck in the limitations of conventional medicine, and that's exactly why I created Holistic Health with Melissa, to take you on a journey from conventional to crunchy. Here you'll get empowering wellness insights, practical tips, and faith-centered strategies to help you feel your absolute best. In each episode, we'll dig into what true health and wellness really means. We'll dive into nutrition, lifestyle, mindset, and detox, all things so important to your health. We'll chat about raising kids with intention and living life of faith. So join me to reclaim your energy, embrace your healthiest life, and find joy and purpose along the way. Welcome, everybody, back to Holistic Health with Melissa. I am so excited that you are here today, and I'm really excited to dive into this conversation. Dr. Minjeur is joining us from Cedar Rapids, Iowa. And I am so excited to dive in. I've listened to some of your podcasts, Dr. Minjeur, and I was just fascinated by everything that you have to say and offer, and I love what you talk about on your podcast. I think particularly with like women's health, cycle health, and like all that goes along with that is so not talked about, and women don't know what's healthy and what's not. So I'm super excited to dive into this conversation with you and unpack all of that as much as we can.
Yeah, thanks, Melissa. I'm so excited to be sharing with your audience today.
Yeah, thanks for being here. So let's just start there and tell me kind of like who you are and what do you do, and how you got into this.
Yeah, so I'm Dr. Monica Minjeur. I'm a family medicine physician, and I have been in practice for about 12 years now. But during my residency training, I actually went and got some additional training beyond family medicine scope in what's called restorative reproductive medicine. And for people that don't know what that is, it's basically the evaluation of what happens with menstrual cycles, fertility awareness, all of these things that can really help to uncover kind of the root cause of menstrual cycle abnormalities or fertility concerns. And so really just found this kind of better way to treat women's health. And so have been practicing that for about 12 years now. And so about 2 years ago, in the summer of 2023, I actually left my employed family medicine position and founded my own clinic, Radiant Clinic. And so we are in Cedar Rapids, Iowa, but we also provide telehealth medical services for people all across the country in many different states. And our whole jam now is helping women with menstrual cycle irregularities. So whether that's perimenopause or PMS or menstrual migraines or PCOS or the other alphabet soup that comes with menstrual concerns. So that's about half of our practice. And then the other half of our practice is in helping couples that are struggling with fertility challenges. And so, really, again, digging to root cause healing and helping people to either avoid IVF, or sometimes people come to us after they've already tried and failed IVF in order to really dig deeper and look for those root causes. And so it's been a real wild journey to kind of work with people in this space, but really to see, how much education is lacking, like you mentioned with women's health, just how much people don't know and aren't told. And really, it's not even something that I learned in medical school. It was that additional extra training that I had during residency, as well as continuing education at this point in time. So we love what we do. I have a team of other women that work with me as far as health coaches and charting instructors and dietitians. And really, all of us, our whole goal and mission is to help with restoring natural menstrual cycles in order to improve health and promote fertility. And we just love what we do. And we're so honored to serve women and couples in this way.
I love that so much. I feel so passionate about like getting this information out to people because there is just like you said it, like you didn't even learn about this stuff like in medical school, which is just
Right.
kind of like mind blowing, but also like kind of infuriating. Like what? Like how come you didn't already know this? You had to do additional training, which just like begs to say like your average PCP or like average doctor that you're going to see in the ER or fertility doctor even maybe like doesn't necessarily have the information that is actually going to help you, which is kind of sad and
Yeah.
disheartening. And it's so all the more like kudos to you for going above and beyond and getting that additional training to learn about this so that you can help people in this way. Because we know like infertility is rising. And I'd love
Yes.
to kind of like shift there and talk about that and like in practice, what do you see? Like what do you think? Why are we seeing infertility rates rise and this like epidemic of women not being able to get pregnant and then having to go down the route of IVF, and sometimes that's not even successful. What do you think about that? I know that's a big question, a lot to unpack.
Yeah. No, and I think ultimately it comes down to lots of things, obviously, but kind of if we were to group it into a couple of different buckets, number one is always in my world, it's always lifestyle. So stress is pervasive. Anytime I ask people if they have stress, like I don't even have to ask. Like everybody that comes through our doors, like, yes, my stress is through the roof. And so whether that's from, work or home life or finances, or sometimes even just the stress and trauma of not being able to get pregnant, that stress is so pervasive. And that's not just emotional stress. That sometimes is physical stress. So lack of sleep or not eating well or recurrent illnesses or relationship stresses, all of those things play a huge role when it comes to our hormones. How our body responds to those stresses really dictates how well do you ovulate each cycle? Are you even able to get pregnant? So that would be kind of the first big bucket. The other would be is hormone changes. And so there are so many times when we do our hormonal evaluation, we do lab work, we evaluate what's happening from a cycle standpoint. And importantly, when we're looking at fertility, we're looking at both the female and the male factor, because I think so often male factor, they get a seminal fluid analysis that's checked, they're told it's normal, and they're like, oh, it's not you, see you later. And the reality is, it's not just about the number of sperm that are present, it's all about what's the quality that's present as well. There's lots of great studies showing that male factor plays a huge role when it comes to pregnancy, specifically with development of the placenta early on, as well as prevention of preterm birth and preeclampsia. And so there's all of these factors where we say, okay, this is not just about can my hormone levels be adequate enough to get by? It's about what are the optimal hormone levels that I need in order to function. And again, a lot of that comes back to stress and lifestyle, but there's also a lot that goes on in our diet, in our environment. Sometimes the different things that we're exposed to can actually mimic hormones that aren't actually there. And then there's this other kind of pervasive thought in conventional medicine that if your labs are in the quote unquote normal range, everything's fine and you're
Yeah.
normal.
Yeah.
And the example I always give is progesterone levels because it's a common one that we find. Progesterone levels for a woman, if I check you at cycle day 7 when you're early in your cycle, your progesterone should be very, very low. If I check you at the conventional medicine day of cycle day 21 and your levels are low, oftentimes women are told you're not ovulating, therefore you have to go to IVF. The reality is you maybe just didn't ovulate yet. Maybe you're going to ovulate a little bit later. Maybe you ovulated on day 24 and we actually needed to check your lab levels a week later. And that's where we see, great, now progesterone should be somewhere closer to 18 to 20. And if you look at the lab reference range, it's going to say normal progesterone is anywhere from zero point 0.2 to 48. Like that is such a huge range that it is impossible to know, is this normal? Is it not? Where are you at in your cycle makes all the difference in the world. And that's the part that really, I think, needs that fine tuning is it's not just about making sure, yep, my hormones are there and like I'm having a period. No, it's so much more about how are we optimizing those hormone levels. And there's so many things that can disrupt that. We could do probably a 4-hour talk just about that. But that I think would be the other big area. So lifestyle being primary, and then hormone levels and optimal balance being the other big thing. And again, male factor is just not being talked about enough. We find male factor concurrently with female factor about 25 to 30% of the time.
Oh,
And
wow.
about 20% of the time, we find just male factor and that there's no female factor. So if you think about that, we're looking at anywhere from 40 to 50% of the time, male factor plays a role, if not the sole situation. And so often we need to be digging deeper than doing just that cursory evaluation.
Yeah. I love that you brought up that normal doesn't mean optimal. Like
Yes.
your labs can be normal, and that doesn't actually mean, and lab reference ranges actually change, right? Like they lower, like testosterone is a great example. 100 years ago, the normal for testosterone was actually significantly higher than
Yes.
what it is now. And there's a lot of research, and I don't know, I'm not an expert on testosterone at all, but in men, but you there's so many different factors that have lowered it, but now over a certain number of like men have lower ranges, so they've actually just lowered the standard,
The bar.
right?
Yep.
At the lowered the bar, and now the reference range is actually like significantly lower, where it's like, well, wait a second, is that actually just because the majority of the population has a low testosterone, is that actually normal? Are we just accepting that as normal? Because it's probably not a good thing.
Right.
Like,
Right.
so why is it like that? And I have my theories on that, but we won't go there. But um, when so when we're talking about like women's cycles, what are some early signs that somebody would know that their cycle is like off when it's not just about like having a period? How would they know if their cycle's off, and how do we begin to kind of like decode those signs and understand what it's telling us?
Yeah, this is probably the most common question that we get asked, and it is the foundation for everything that we do. And so that's why we have so many charting instructors that work with us. So these fertility awareness method charting instructors, their whole gig is to teach women, how do I identify what's going on with my body and when. And so we use different markers that our bodies show us in order to identify, when am I ovulating, when am I fertile, what does that window look like. So some people have heard about, if you're tracking either your cervical mucus or maybe basal body temperature or urinary LH strips, there's a lot of different ways and different things you can do to track that. There's different methods. We don't need to get into the details of all of that today, but really just helping women and kind of walking along that journey to say, here's what I'm identifying from my body. And then being able to put that into a readable format to be able to say, okay, when I look at this at a chart view or a calendar view, I'm able to determine, do I see that I'm ovulating, yes or no? and what time frame is happening, when am I seeing that happen as far as ovulation goes? Does it seem like it's really close to when I'm having my actual menstrual bleed? Does it seem like I ovulate and then 4 days later I have my period? Those are big warning signs to us that say, hey, there's something going on. So once we're having you track your cycles, the two probably biggest things that we see to indicate that there's a problem is, first and foremost, if you aren't identifying any signs of ovulation. So you can still have a period, but not be ovulating. And we talk about ovulation in our world as the vital sign in order to tell us, hey, menstrual health is okay. It doesn't mean that if you're not ovulating, it doesn't mean that that's the problem. Usually there's something else that's causing you not to ovulate. And so we need to dig deeper. But if we're not seeing signs of ovulation, that's a big warning sign. And then the second would be is as we have all of these symptoms that are showing up, telling us where you're at in your cycle, we start to overlay then where and when do you have other symptoms. So for some people, if they're struggling with migraines or acne or irritability, and then they start to plug that in over time and they start to go, oh, interesting. I'm always having my migraines that start 3 days before my period, or I'm super irritable or can't get enough chocolate into my belly in order to satisfy that craving a week before my period. And then we start to go, okay, these symptoms are likely related to hormonally what's going on. And so we can then very easily at a glance look at that charting, look at your symptoms, and be able to marry together and go, okay, we estimate this is likely what's going on. We back it up with checking labs at certain times during the cycle, and then are able to really dig in and find, okay, why? Why is this thing going wrong? Because ultimately it's not about that band-aid fix. It's not about, here, just take birth control and it'll make everything go all right.
Yeah.
It actually typically makes things 10 times worse. And so the reality is, trace it back and say, okay, why are you not ovulating? And we dig in and find what those root causes are, fix those things, so then your body will be able to ovulate again on its own. So really just tracing it back really deep, but realizing like you are going to be the person that finds those things first. And that's where that education is so crucial, is that we want to empower women to understand their own bodies, to track their cycles, to be able to go into their healthcare professional that they're seeing and saying, there is a problem. I know that this is what's going on and I'm not sure why. Can you help me figure this out? Because when women speak up and really have that voice and are able to say, here's what I'm seeing with my cycles, oftentimes they're blown off and they're just like, yeah, whatever. You're like, sorry, you're in your 40s. Like, just deal with it. That's the way it is. Like, no,
Yeah.
that's not okay at any stage. And so giving women this voice to say,
Because
here's what's
doctors
going on,
don't
here's my
know,
chart.
right? Like they
Exactly.
weren't taught and they're like, oh, well, like
Exactly.
probably normal. They just don't actually know. And then
Exactly.
women are conditioned, women especially, but like people in general, we're conditioned in our culture. Like if the doctor says something, like that's it. Like you don't question that. If the doctor says you need to go
Yeah.
see a fertility specialist, you're going to go see a fertility
Yes.
specialist.
Yes.
Wow.
Yeah.
So good.
Yeah. Yeah.
So outside of like I can see obviously for fertility health, like tracking your cycle, paying attention to what it's telling us. But outside of that, when we're talking about like whole body health, what about for the woman who's not trying to get pregnant? Why is it so important for us to pay attention to our cycles and to understand what it's telling us as we move in, from child rearing age into perimenopause and then menopause?
Yeah. So oftentimes what I'll tell people is like, not having a cycle is not a good thing. I had somebody actually that I saw in clinic last week and she said, well, I'm not having periods, but that's okay. I'm fine. And we said, oh, actually, no. Like it's again, it's kind of that window into what else is going on and why is this a big deal? So a couple of things play a big role with this, especially if you're looking beyond fertility. If you're not ovulating regularly, you are going to have an increased risk long term of things like low hormones, which can lead to osteoporosis or bone loss, cancer risk, brain health, dementia, especially when we talk about like low estrogen levels, for example, can cause a lot of those problems. And we find that low estrogen is a very common reason for your cycles to just stop happening or to that you're not ovulating regularly. And so oftentimes women will be like, well, it's fine. I don't mind not having a period. Like, I don't need it. Well, you do, because we want to make sure that your hormone levels are optimized. The other is that sometimes the reason that your cycles go awry or decide to stop ovulating or stop having a cycle altogether has nothing to do with the hormones you would think of. So it may not have to do with your estrogen or progesterone. Maybe it's a sign of thyroid imbalance, or maybe it's a sign of insulin resistance or prediabetes. And in those situations, they can be kind of a sign that says there's something bigger going on here from an overall health standpoint. So even if you're not using your cycle as far as evaluation of fertility, it becomes this amazing marker where your body just says, hello, red flag, something is not right. We need to work together to figure out what that is and to fix that, because I'm not interested in just like, yeah, let's make sure you get pregnant and make sure you're ovulating. I'm interested in how are we improving your overall health for the
Yeah.
long term. And being able to identify those patterns really is what clues us in to say there is something amiss here. And that's why it's so important to be able to know when is something going wrong. If you're not tracking it or you don't know, you're not going to have a really good understanding of when to know, is it normal versus abnormal.
Yeah. It's amazing to me how many women actually don't track, right? And they just
Yeah.
like if you ask like when was your last period? I don't know, like maybe like this day. I'm like
Yeah.
asking you like if that's right or not. Like I wasn't
Yeah.
there, so I don't actually know.
Yeah.
What are some simple ways that the listener can start tracking her cycle today, even if she's never done it before, she doesn't know what's normal, what's not. What can she start tracking, and how can she start, what are the symptoms that you would say pay particular attention to?
Yeah. So probably the easiest or the most straightforward is observation of cervical mucus. Now, I always tell people do not panic. This does not mean you have to do an internal exam. It is nothing crazy or scary. But many women have an awareness of what's the sensation that they feel when they go to the bathroom and they wipe with the toilet tissue. And oftentimes, if you start to just pay more attention to those things, you're going to start to notice, hey, it feels dry like sandpaper, or it feels like it's a slip and slide, right? And so just that sensation difference can make a big difference. The other is if you are noticing or observing actual mucus on that toilet tissue, that typically is a good sign of fertility or ovulation window. And then one of the ways that we really like and we use all the time in our practice is our very favorite app. It's called Chart Neo or Neo Fertility app. And it is a free download, so you can use that for the first 45 days. Beyond that, it's a nominal fee to be able to continue to chart your cycles. But I really like that app because it allows you to plug in whatever data is most relevant for you. So, like I said, cervical mucus is typically the most obvious. It doesn't require a bunch of fancy devices, it does not require a high level of education. And even within the app, there's some videos that are built in that kind of teach you here's what you need to look for and observe. Now, if you're trying to utilize one of these methods in order to avoid a pregnancy, we always recommend working with a certified instructor because we want to be able to give you some guidance on that. If you're charting just for general health and you don't need it in order to avoid a pregnancy, or if you're trying to conceive, then you can just pick it up and just kind of go from there. But really, the idea here is just start with something. Like I said, I mentioned cervical mucus because it's typically the most obvious. You don't have to buy any fancy devices. You don't have to get anything else different where you have to go purchase it from the store, go to the lab every day, or anything nutso like that. So it becomes really sustainable over time. We teach these methods even in third world countries where there is no, where they are illiterate, where there's no actual toilet paper, and they are still incredibly effective to be able to use to track their cycles. So very, very basic. A great place to start is just start to observe those symptoms that you're noticing.
I love that. And how about like, is it also important to notice like the date of the start of the period, right? And the
Yeah.
length that's slow.
Yeah. And so I think one of the things is when I ask women, tell me about your cycle, most people are able to identify, well, this is when my period starts, but they can't identify the ovulation window. And so that's where we differentiate the two. Now, they're both important, absolutely. And certainly if we start to see, like, okay, I'm having a period, but it's only happening every 40 days, that's not really normal. So ideally, we're looking for a period to happen roughly every 28 to 35 days. Now, there can be a little bit of wiggle room with that, but really that's kind of what we're looking for from menstrual cycle to cycle. Now, if you add in the extra layer of really tracking and knowing when am I ovulating, that's actually a much better predictor of overall health of your cycle as well as overall health. And so that's where we say the ovulation evaluation or the fertility window is even more important than what we're seeing for the bleeding pattern. But absolutely, that menstrual bleed is super important as well.
I love that you mentioned that. That's such a powerful tool for people to understand. It's like really focusing on that fertility window that you're talking about. I love that. when women are trying to, I hear a lot now too, especially I feel like this just people are kind of like moving back towards like more holistic medicine, natural medicine, wanting to kind of like do things without figure out the root cause, right?
Mhm.
So I hear people a lot asking like, what are some natural ways to balance my hormones? So I'd love to hear from you, like what you feel like are your, I don't know, top one or two tips that you think are the most, um, what will move the needle most to help women get closer to like balanced hormones or feeling more like themselves, especially if they're struggling with like PMS or irregular cycles or things like that, whether it's
Yeah.
like food or lifestyle or whatever you think.
Yeah. So we have five that we talk about. I'll give you my top two. But number one is sleep. Almost nobody that I talk to is getting enough sleep or not restful sleep, or we're watching screens right up until the time when we go to bed. And so then your body doesn't get into that deep sleep. So we talk about sleep all the time. People roll their eyes at me. They're like, are you kidding me? There's no way I can get more than 7 hours of sleep. But sleep is the number one thing. And so we always talk about aiming for at least 7 to 8 hours of sleep per night, ideally uninterrupted if possible. But, life can happen sometimes. We know that that can be a part of it, and really focusing on what is the sleep environment. So we dig deep into, okay, how dark is your room? How cold is your room? Do you sleep through the night? Do you snore? What does that look like? How often are you having screen time right before bed? And really just going deep on that, because overnight is oftentimes when we see cortisol levels will be at their highest peak. And so we want to make sure that we're resetting, that things are at a good, healthy status. It's also the time when your metabolism resets. Lots of hormone production happens overnight. And so sleep is the number one thing that will send things totally sideways if you're not sleeping well. So that'd be the first most important. And then the second that we see that is very, very misunderstood, and so it's the reason that we talk about it so often, is exercise. And especially if women come in and they have this idea of how much they should be exercising, I always tell people there is exercising for health and there is exercising for hormones, and sometimes it's not the same thing. And what I mean by that is that if you are a woman who comes to me and you're trying to lose weight and you're exercising and going to the gym for an hour a day and you're breaking a sweat and all of these things, that may be helpful for certain things, but it's not going to be happy for your hormones. Your hormones are going to be really angry that you are exercising that much. And so typically we talk about gentle exercise, meaning equivalent of walking, gentle stretching, yoga, Pilates, something like that, 30 minutes per day, 5 days per week. Anything above that can be harmful for your hormones. And so there are certainly cases where more exercise is better. And again, if I put on my just general family medicine doctor hat, there's lots of reasons why more exercise is good. But from a standpoint of your hormones, it can be a fine balance. Now, there are some exceptions to that. The only thing in women's health world that we know is that women who have a diagnosis of PCOS or polycystic ovarian syndrome actually do better with more intense exercise. But again, not every single day. So we still say we limit that to 3 or 4 days per week. And again, it's all about that balance. And so that's the other one that we really help women with, is to say, not too much, not too little. Where's the sweet spot with that? It can be a little bit fussy, but oftentimes we find that women are way over exercising, and it can totally tank your hormones because it increases cortisol, or your stress hormone, which can trash the rest of your hormones. And so I'd say those are
Right.
probably our top two that we talk through, is sleep and exercise modifications.
Yeah, because exercise, like you were saying earlier, like not just emotional stress, but like physical stress, like exercise
Yes.
is a stressor to your body, right? Like sometimes
Yes.
it's a good stress. And like you so eloquently said, like sometimes that there is a benefit to doing more exercise, but sometimes it's not. And I think that's the like key that I really want everybody to hear is this is the beauty of personalized medicine. I
Yes.
think personally, as a nurse, like I started nursing 15 years ago, and I was coming into nursing right at the time where standardized medicine was like taking over, and we were like, oh no, this is like protocol. You know, somebody comes in with this and they get X, Y, and Z. Somebody comes in with this and they get A, B, C. You know, so it was like really standard across the board. Everybody gets these if they fall into this category, and it's like that's actually not a great way to actually achieve outcomes, health
Right.
outcomes. In it maybe is in some ways, but when you're really like diving into the like the unique beauty that God has designed us each individually with, our own set of DNA and our own, environmental factors and past history and all of that, when you're diving into that personalized area, that's where the beauty happens, because that's where you can really achieve those goals. I think standardized medicine, I think, is a big scam, and like
Yeah.
personalized medicine is where it's at, because that's where you're going to achieve. Not everybody should get the same prescription for this. Like, some people need something different, and you have to use some critical thinking skills. And so much of it, that's the other point that I really want to go back to too, which you also just touched on, which is like, so much of it, like, I focus on trauma recovery, you focus on fertility health and women's health and cycle health. And literally what we do is like so much of the same stuff, like foundations, sleep,
Yes.
stress, lifestyle, nutrition. Like, those are the things that are going to be the biggest needle movers. It's the hardest stuff, right?
Yes.
Like, it's so hard to change your lifestyle and get enough sleep, especially in, I was just reading something the other day that was saying that like 50 years ago, the average, I don't know how they know this, but whatever. I don't know how true it is, but it was really fascinating. And I was like, I feel like it's true. But like 50 years ago, the average adult human was making like 2,300 decisions a day or something. And now we're making like 50,000 decisions a day. Like,
Yeah.
from just like, what am I going to eat right now?
Wow.
What's going to take my attention right now? Because we're constantly just inundated with information and notifications and just busyness, right? Like, our culture, the industrial revolution, like, thank God for technology, but it has created an environment in which we are farther away from health than ever before, I think.
Yes.
Like, really getting back to the foundations, that's going to create health, because it's not about this new pill or a fad diet or HRT to or birth control to balance your hormones. Like, it's really about the foundations, restoring the balance that already exists inherently, divinely inside of your body, just about restoring that balance, I believe.
Yeah, absolutely. I always joke in my practice, I say, I don't get any drug reps that come to see me because everything we do is all so back to the basics. Like, yes, we prescribe some medications, but they're generic. They're stuff that's been out forever and a day. Like, most of what we do is all lifestyle medicine. Let's talk about foods that we need to be eating to get more of X, Y, and Z. Let's talk about, if there are medications, how are we going to utilize them? But absolutely, it does come back to the basics so often, and it's not always about what's fancy, what's new, what's the best thing. It's about, hey, let's get back to basics, because ultimately, 99% of my patients that come and see me, they don't want to be on meds. They don't want to have to be on something long term. And so, yes, we utilize those things sometimes to help move them in the right direction, but we're always talking in the background about what are the lifestyle changes we're making with the intention to come back off of these meds or supplements after we get healing in place. So, absolutely.
I love that so much. Dr. Minjeur, what a pleasure to talk to you. And just, you're such a wealth of knowledge. I feel like everybody should, if they have any concerns about their cycle, or if they're struggling with infertility, they should reach out to you for sure. But before we talk about how they can get hold of you, I'd love for you to tell us if there was just one thing that you think that every woman listening needs to know about her body, like right now, she needs to know this, what would it be?
Your body is beautiful. Your body is not broken. If something is not going as you expect to see it with your cycles, with your fertility, it doesn't mean there's a problem with you. It's just your body trying to tell you, hello, please listen, please find me some help. And so it's really common for us to say, I am broken, I'm a mess, I'm a dumpster fire, whatever. It's not you. Just listen, find the help that you need, find the resources you need, and find somebody who will listen to you because you know your body best.
Oh, I love that. What a powerful message. If people want to reach out to you, how would they do that?
Best way to find us is through our website, which is holistichealthclinic.com. From there, people can actually book a free discovery call with me. So if you're interested in working with us or finding out more about our services, check out our website. You can book that free discovery call right on the website, and I'm happy to pop on a phone call to determine are our services correct for you. If I'm not the right fit, I promise I'll let you know, and I'll usually point you in the right direction of what you need to try instead. And then we also have a podcast. It's called Cycle Wisdom. And that is typically fairly short episodes, 15 to 20 minutes. So if you have any particular menstrual concern or fertility question, go check out that podcast, and you can typically find an episode that will apply to exactly what concern you have. And it'll give you some tips to say, hey, here's what I can try on my own. And if this isn't working, here's where a restorative reproductive medicine approach could be helpful and what that would look like.
That's fantastic. What a good resource. Everybody, so that'll be all be in the show notes. Everybody go check out Dr. Minjeur's podcast. Check out her website. If you want to reach out to her, please do that. She obviously is a wealth of knowledge. And remind me, you see clients all over the country, correct?
I do. I actually have some international clients even. So yeah, we can see patients in many
Perfect.
different states. If we don't currently have you under our coverage as far as medical licensure, we can typically get coverage pretty quickly in most states, just the way that our medical licensing works.
Awesome. Well, thanks again, Dr. Minjeur. It was a pleasure. Thank you for sharing all of your wisdom. And to everyone listening, thanks for listening. Tune in to the next episode.
Awesome. Thank you.
Hey everyone, thank you so much for tuning in to Holistic Health with Melissa. It is such an honor to have you here. If you found value in today's episode, would you share it with a friend who might need it too and leave us a review? If you have questions or topic suggestions, reach out on social media or visit our website, holistichealthbymelissa.com, and take care. I'll catch you on the next episode.